As we talk about what drives health outcomes, you can see how in the US we spend more per capita than many other countries. However, we have less optimal health outcomes. And one would ask, how is that possible? We see that those countries that have a better health outcome than the US, they are spending in social services, while we spend more in healthcare specifically. And so we US spend more in healthcare, they spend more in social services, they have much better health outcomes. You know how the social and environmental determinants of health, in fact, count for over almost 40% of one's health outcomes. You add that, behaviors, another 30%. So you have that basically 70 to 80% of our health outcomes are driven not by the healthcare system. And that's where we invest in the US. So that tells us how and why, although we invest that much money, we have poor health outcomes. We tell people what to do. Eat 5 vegetables a day, run 30 minutes a day, but we do not focus on creating the conditions that allow people to exercise those choices and those behaviors. So that is another image that I always keep in my mind, which is a pyramid. And if you look at the top of that pyramid are the things that we do that have the less impact. And then as you come to the bottom of that pyramid, there are the things that we do that have the most impact. Most of the time, public health invests on the top of that pyramid, which is health education and communication. And instead of investing at the bottom of that pyramid, which is in the social determinants of health. So we shifted the investment and we start investing our funds through the health equity zones at the bottom of that pyramid. We wanted to really honor the expertise of those folks who have the lived experience of the communities, and their stories, along with our data, create the perfect set of information that is needed for changing communities and building our communities.